Hello friends, and welcome back to our channel, where we offer you the most up-to-date health advice and knowledge to protect you and your loved ones. We are delving deeply into stomach cancer today, a crucial subject. Gastric cancer, another name for stomach cancer, is a dangerous illness that claims thousands of lives annually throughout the globe. It is essential to comprehend the risk factors linked to stomach cancer in order to avoid and discover it early. So let us look at the top 5 things you should know about your risk of stomach cancer. The bacterial ailment known as Helicobacter pylori, or H. pylori, is first on our list. More than half of the world's population carries this bacterium, which is one of the most frequent causes of stomach illnesses. Although H. pylori infection does not guarantee stomach cancer, it does greatly raise the chance. The bacteria can alter the stomach lining and induce persistent inflammation, which increases the stomach's vulnerability to malignant growths. Regular testing and treatment of H. pylori can help reduce the risk. If you have symptoms like persistent stomach pain, nausea, or bloating, it's important to consult with your healthcare provider. We move on to nutritional considerations. The food you consume has a big impact on how likely you are to have stomach cancer. Consumption of a lot of pickled, salted, or smoked food may raise your risk. These foods include ingredients like nitrates and nitrites, which the stomach can transform into chemicals that cause cancer. Conversely, diets high in fresh produce, especially produce high in vitamin C, may offer some protection. To lower your risk, focus on a diet that includes plenty of fresh produce, lean proteins, and whole grains. Reducing your intake of processed and salty foods can make a big difference. Another significant risk factor for stomach cancer is smoking. Carcinogens included in tobacco smoke have the potential to harm the stomach lining and cause malignant alterations. According to studies, the risk of stomach cancer is twice as high for smokers as it is for non-smokers. The good news is that you can lower your risk considerably by giving up smoking. It is never too late to give up, because your body starts to mend practically instantly. A word of caution: before making significant changes to your diet, it's always a good idea to consult with a healthcare professional, especially if you have any underlying health conditions or are on medication. If you like what you've seen thus far, please click the like and subscribe buttons and the bell notification. Thank you for viewing. Your chance of acquiring stomach cancer is also influenced by your genetic makeup. Your risk is increased if you have a family history of stomach cancer, or if you have specific hereditary disorders such as Lynch syndrome or hereditary diffuse gastric cancer. If you have a strong family history of stomach cancer, genetic counseling and testing can be important steps. Knowing your genetic risk allows for closer monitoring and early intervention if necessary. Last but not least, a long-term inflammation of the stomach lining called chronic gastritis can raise your risk of developing stomach cancer. A history of stomach surgery or conditions like pernicious anemia, which impairs the stomach's capacity to create acid, may further increase your risk. Managing underlying medical conditions and regular monitoring with your healthcare provider can help reduce this risk. So, those are the top 5 risk factors for developing stomach cancer: Helicobacter pylori infection, dietary factors, smoking, family history and genetics, and chronic gastritis. While some of these risk factors, like genetics, can't be changed, others, like diet and smoking, are within your control. By making healthier lifestyle choices, you can significantly lower your risk. Remember that early detection is essential. If you have a higher risk of stomach cancer, discuss screening alternatives with your physician. As usual, keep yourself informed and take preventative measures to safeguard your health. Thanks for watching. If you found this video helpful, give it a thumbs up and share it with your friends and family. Don't forget to subscribe to our channel for more health tips and information. Stay healthy, and we'll see you in the next video. Disclaimer: this publication serves purely as an informational resource and should not be construed as a substitute for professional medical advice. For health-related concerns, it is strongly recommended that individuals seek guidance from qualified healthcare professionals. While every effort has been made to ensure the accuracy and reliability of the information provided, the publisher bears no responsibility for errors or omissions.